success. So especially when it came to medical abortion, we worked across the aisle with different nonprofits, brands, and different advocacy organizations to really amplify this message. Plan C is a great nonprofit. They are one of those companies I was speaking about that can go into any state and really, give resources for how do you get this medication online. We are linked on their site, and they have massive SEO power, from an acquisition perspective, and so that's been really beneficial. And more than that, they link to us as a resource so patients around the country can find us. August is a very Gen Z forward brand. They do organic and sustainable tampons and period care. They've got a very personality-driven brand. Nadia Okamoto is their CEO. If you don't follow her on TikTok, you absolutely should. And that company has a little bit more leeway too to be a little bit more, I would say, political and speak to different generations. And so we worked with them and including their their pads in our medical abortion kits. That's not something that we produce. We're not in that business, and they were more than happy to do that at cost. And so we were both working together on these kits that then are FedExed over to patients in the state in which we serve. Abortion Freedom Fund is another organization that we worked with that they're amazing. They are the first telehealth abortion fund. So as we were looking for partners to partner with on being able to provide financial assistance to patients who couldn't afford abortion, because that was really important to us as a brand to increase access to most folks, even if you can't afford it. Most of the national abortion funds were only set up to provide financial assistance to clinics. And so that was a really interesting learning. So we kind of quickly got connected to folks in the space. Christy Pitney and the amazing providers over at Abortion Freedom Fund make it so that you can get an abortion as low as $50 on our site. And so this is not a product, a service that we're making any money on, but it is something that we know that we needed to provide because we saw, the data and how nervous people were out there and thought that we could really make an impact.